Hello everyone. Thank you for coming to listen to our presentation. This presentation is our winter project. I'm Akiha and I am one of the members of our group E. Our presentation topic is Future Medicine. First, I introduce about how technology will help our life dramatically. Have you ever think about near future? First, please see this movie. It looks like just a light hairband, but the Neko Mimi reads human brain waves and gets his or her feelings. Like this. And it moves and expresses the feeling like cat's ear. Actually, that technology has already developed since 2010. The Nekomimi is now on sale on Amazon. This is one of examples of brain-machine interface. What is brain-machine interface? These machines are connected with human brain and read human brain waves. So, they could act according to commands from the brain without any handlings. The Nekomimi is just for amusement, but how about robot arms? Robot arm is one of practicable examples of brain-machine interface. Now, there is some robot arms for patients who could not move their own hands. However, recent robot arms are so big and not as natural as human arms. Like this. In the future, robot arms will be able to move in more detail, like humans' own arms. Technology can make the better health in the future. Other new technology for better health is nanobot. Nanobot is a very small robot which works automatically. The size is same as a biological cell. We can put nanobots into human body. We can use them in a surgical operation instead of scalpels. When we use them, we no longer need to cut the patient's body. Technology is developing so dramatically, and a lot of new machines seem to make our environments better and better. But now, we have some bad news. First, although medicine will develop, diseases will also develop. From the viewpoint of evolutionary medicine, the cause of a disease is an environmental change. If an environmental change, humans have to adapt it. However, we cannot always adapt shortly after the change. This gap of time causes diseases. For example, because human beings experienced ice age, we became strong against hunger. However, the environment has been changed. We can have a lot of foods these days. Accordingly, especially in developed countries, diabetes patients are rapidly increasing. Furthermore, allergies are thought to be because of urban life. According to Bernd Alm, children who have lived in countryside have less tendency to have allergy. Compared to urban, country has only 30% of children with allergic rhinitis. Like this, incurable disease will not disappear. What is worse, disease will be more complex. Another problem is financial one. Total national healthcare expenditure is continuously increasing. In 2011, it was $38 trillion. Accordingly, the person's average medical expenditure is calculated at 300,000 yen annually. You may think that you didn't pay such a lot. It is because elderly people tend to cost more for healthcare, and you have paid no more than 30% of your care. The rest is paid by social insurance. So, in order to overcome such situation, the change of social system for medicine is important. It is essential to reduce costs and take care of incurable diseases. First, it is important to prevent diseases beforehand. If you have diseases, problem is not only its costs. It reduces your quality of life. It mainly focuses on lifestyle. Lifestyle change will be promoted by medical practitioner, local government, and local community. Second, integrative medicine will be the mainstream medicine. It integrates many kinds of medicine and therapies. For example, Western medicine, traditional medicine like Chinese medicine and Indian medicine such as Ayurveda and yoga. In addition, herbal medicine, music therapy, aromatherapy, rehabilitation, and nursing. All of them are integrative medicines. It will reduce medical expenditure. For example, aromatherapy and music therapy don't require investment for developing new medicine. But some of you may have a question. Are they really effective? Let's see acupuncture as another example. According to WHO, it is effective for these illnesses. So, integrative medicine can save our future in terms of both effectiveness and costs. For example, music therapy could be effective for such mental illnesses. Some of these illnesses could not treated well by Western medicine. Integrative medicine will be transformed into holistic medicine. It focuses on not only physical illnesses, but also mental or spiritual ones. And also, there will be a paradigm shift from curing to caring. In this context, cure means just replacing disease by a treatment. Care has more broad meaning. It looks also at health of mind and quality of life or life supporting. For instance, if results of examination says no problem, this patient cannot have chance to be treated by contemporary medicine even though he or she is suffering from pain. But these patients will be treated in future in some ways like traditional medicine or therapy. Diabetes can be cured by kidney transplants, but mental problems like feeling of sins or anxiety should be treated as well. Third, future medicine will be based on the concept of localization. It will encourage people to participate in local communities with different generations. It is because life with communication leads to healthy life. In addition, if people have relationship with community members, it might be easy to find something unusual. According to Hinohara Shigeaki, those who have jobs have healthy lives than those who don't. What is important is not just to live longer, but to live healthy. Therefore, aged people should have jobs. According to J.R. Diamond, each age group has sustainable kinds of works. Aged people tend to be good at management, administration, or teaching because they have knowledge and experiences. He argues that Japan's mandatory retirement system is stupid and it should be abolished. Then, let's move on to conclusion. Future medicine will be technological, of course. At the same time, system change is important as well because we will have serious problems. Therefore, future medicine will be eco-friendly, low cost, and sustainable. However, new technologies and environmental changes will force us to think about ethical problems. We have to keep on thinking critically about it and think about what is important in our life. Because this problem is directly related to our happiness. Let's hope good luck for our future. Thank you for listening.